So quick disclaimer, I'm a certified licensed athletic trainer in the state of Texas. I've been working at the secondary level for 8 years now. This information is solely for educational purposes and it's not meant to treat or diagnose any illness or injury. Okay, so I wanted to make a quick video on the Tony Pollard injury. You know that he fractured his fibula and he has a high ankle sprain. We'll just want to cover each one of those things. We'll cover treatment and recovery times for him and what I think his future may or may not look like. Okay, so the first thing is a fibula. What the doctors are probably going to do is an open reduction internal fixation, and they'll put a plate and that'll allow for the fibula to completely heal and heal well. The next procedure that I hope that they do, especially for a high level athlete, is called a tightrope surgery for high ankle sprain. Now the reason for this tightrope is because with the syndesmosis, okay, that's where the fibula and the tibia come together. That's the ligament that's damaged, okay? So what the tightrope does is mimic the syndesmosis and allow for some movement of the fibula, because every time you take a step, the syndesmosis does help translate some of that force up the leg. So in previous surgical procedures, what they would do is actually put screws through the fibula into the tibia, and it would be a fixation. So they would fixate the syndesmosis, and this would change the whole dynamic of the foot mechanics, midfoot mechanics, ankle mechanics. Even at the knee, we would see pain. So that's something that I hope that happens for Tony. If the tightrope procedure happens, I believe that he will make a decent recovery. And if they did some sort of fixation to that joint, okay, the syndesmosis, I don't think that you're going to see the same explosive Tony Pollard in the coming seasons, especially as he ages and goes through the NFL. Again, for a high school athlete, this is no problem because, again, we're talking a lower level. It's much less explosive. And then you kind of see in college, okay, again, we talk about, the 1% of the 1% of the 1%. In the NFL, it's a very elite level. So these guys need to have the best care. They need to have the best procedures done in order to continue the career that they're on and the path that they're on. So that's the biggest thing, is I hope that Tony gets a tightrope procedure. Now, in terms of treatment, this is going to take him, it's going to take him quite a while. And in certain reports, it says 3 months. I would give him more 4 to 6 months just for complete healing and getting back into the groove of things. Because again, the bone is going to take about 6 to 8 weeks to heal. So that's already 2 months out. And then the syndesmosis should be healed by then as well. And then we start to kind of introduce a little bit of weight bearing. You start to introduce some strength. We start working on balance. And then there's a progression that we like to go through in terms of range of motion, strength, agility, proprioception. You have all this stuff that we need to cover before he can get into the explosive movements of sport. Okay, so that's the biggest thing, is he needs to make sure that we have complete healing. I have no doubt that the doctors, the athletic trainers, the physical therapists, whoever's working on him, know what they're doing. This is why we go to school. This is why we do what we do. And I hope that this young man recovers.